maybe you enjoyed some spicy food and now you're dealing with some heartburn, but there's a high-tech way to diagnose it and whether it could be a regular problem for you. Joining me right now is Dr. Melissa Magrath, a gastroenterologist with White Plains Hospital. Good morning and thanks for joining us.
Hey, good morning. Thank you for having me.
Of course. So starting off, what are some of the causes of heartburn and what is the best way you can treat it?
So heartburn is super common. Most people will experience it here and there in their lives. And some of the common things that trigger it will be sort of like how you eat and what you eat. Things like alcohol, spicy or very fatty foods can trigger symptoms, and also how you eat. If you're overeating, eating too large of a meal, it can produce symptoms in some people.
Can be a big issue for a lot of people that I know, at least myself included. Tell me about this new high-tech diagnostic tool now at White Plains Hospital that can track heartburn data.
It's called a Bravo test, and it's a great diagnostic tool we can use to directly measure how much acid reflux a person is having. So it's a small capsule that's placed at the time of an endoscopy while the patient sleep under anesthesia, and it is an acid sensor, so it measures how much acid's coming up from the stomach into the esophagus, and I can tell exactly how much acid reflux someone's having, when they're having it, and it gives us very precise information about what's happening inside the body.
And how does the diagnosis help with development of a treatment plan?
So it helps us very, very precisely treat a patient because the results can vary from someone having acid reflux every single day, where I might say to them, you should take a medication to treat this. Or, for example, I had a patient who had a big barbecue meal and a margarita, and that night she had tons of acid reflux. So in that case, I was able to tell her, as long as you sort of like limit these big meals and the drinks, then you might feel a lot better.
All good tips to know right there. Dr. Melissa Magrath, thank you so much for joining us this morning.
Thank you for having me.